So today I'm going to start by teaching you guys how to give subcutaneous fluids to your pet rabbit at home. As a reminder, the reason you're probably doing this for your pet rabbit is that he or she is either dehydrated for some reason or has some form of kidney problems, whether it's chronic or an acute kidney or renal problem. So what we sometimes ask our clients to do at home is administer fluids, which are a combination of electrolytes and things that help them to become more hydrated at home rather than here in the hospital. And it's something that is very safe for you to do at home. It's something that we ask a lot of people to do, and it really can help a lot of patients. Our goal is to basically give these injections under the skin to rabbits, and it sort of gives the kidneys a break. So the kidneys are the organ, or one of the organs, that filter a lot of toxins out of the body. When we give fluids, we kind of, in the simplest terms I can think of, give your kidneys a rest. So animals that are suffering from dehydration or kidney problems, this is going to be a really big and important step in their quality of life and in their recovery. So when you pick up from us a bag of fluids, it's going to look like this, and you're going to get a bag of needles. On the back of the bag, there should be some instructions. This one is for ACE, and ACE is going to be getting 100 mils under the skin daily until directed otherwise for recheck blood work in about 7 to 10 days. So usually there'll be some follow-up information there as well. Each of these bags has increments starting basically at 0 to 100, 2, 3, 4, 5, 6, 7, 8, 9, and 10 or 1,000. Each of these numbers stands for 100 milliliters. So if we're giving 100 a day on day 1, which is today, we're going to start at the 0 and go to the 100. Okay. This is the fluid line. The fluid line basically has a couple little pieces of plastic on it. Both of these are ways to stop the flow of fluids. This way is you roll this little ball, this little wheel, and it allows for fluids to come through. When you roll it the other way, it occludes it. And then this is just another clamp to prevent fluid from leaking out. All right, so you can use both of these. I generally, if I'm going to be giving 100 mils once a day, will start by taking the green clamp off, and then I'll go ahead and get my bag set up. So the idea of this is that we want to have the bag above the patient. So you have to decide where you want to do this. You may want to do it with a rabbit sitting on your lap. You may want to have the rabbit sitting on the floor. It really depends on if you have someone helping you, if your rabbit's super jumpy. I'm going to start with Ace on an exam table. I don't really know Ace's personality. I'm hoping that he behaves for me, but if not, we'll regroup. In the meantime, you could take this and put it on a hanger and hang it on a nail in the wall, or if you're in the bathroom, you could put it on, hang it with a hanger on the bathroom, on the shower rod. Right here, I'm just gonna stick it on our paper towel dispenser. And I'm also gonna just make sure that the line has fluid in it. The reason I'm doing that is I don't want to put a lot of air under the skin. This is not an intravenous injection. If a little bit of air, a few bubbles go under the skin, it's okay. We're not going to cause an embolism or anything like that in a rabbit. But I also don't want to electively give a ton of fluids under the, a ton of air under the skin. So I'm just going to roll my wheel up and make sure that the fluids have come all the way through. And you can see they're starting to drip out. That means that the line is primed and ready to go. So now I'm going to check on Ace. Hey bud, how are you? He's ready to come out. I actually forgot to show you a step here. I think we'll show you how to do this before we take Ace out, and that's to put the needle on the tip. So each bag you're going to get is full of these needles. The way to open them is to peel this back, and the needle comes out. It's in a case. So the very first time you use your bag, there's going to be a little plastic protector here, and that just twists off. And you're going to take your needle and it twists on. This little protective cap will secure it so that it doesn't accidentally pull off. So this is just an extra security measure to hold the needle on. And then when I'm ready to give the injection, you just pull the cap off and the needle is ready to go. Okay? Now we will get Ace. Come on, buddy. Hi, honey pie. Hi, bud. Oh, hello. Hello, 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 hello. Okay. He's a little nervous, but that's to be expected. Hey, handsome. Hey, cutie.
We're at 6 minutes, okay?
Okay.
Just so you know.
So we're going to give these injections under the skin. I'm going to make a little tent between his shoulder blades, and the injection is going to come right up here. I'm going to make a tent and stick my needle. So I pull my needle cap off, I make my tent, and I just pop right in. Okay, he didn't really react much at all. I'm going to turn my wheel and start the flow of fluids. And you can tell it's flowing because you can see the droplets going here, okay? Now, on the rabbit, sometimes you may accidentally stick the needle through the skin and you may see water dripping out. If that happens, it's totally okay. Just regroup. But if you do get it right the first time, you're gonna see a little bubble forming here. That's what we want. Fluids under the skin. I can actually feel the little bubble forming. He doesn't seem bothered at all. I like to keep his little face covered so that he's nice and calm. And I'm gonna wait for the fluid to finish. You can give the bag a little squeeze to speed it up. There's no harm in that. And as soon as we get to the 100 mark, we're gonna be done. Now, so that you don't have to sit here and watch me give the whole thing, I'm gonna show you if we were finished, if we were at the 100 mark, you roll the wheel down to stop the flow. You can see the drips have stopped moving. I'm gonna take my needle and just back it straight back out. And then I'm gonna put my cap back on and we'd be finished. Now, when you are done, I like to leave the needle on for the next time that I'm gonna use to give fluids, which in Ace's case is gonna be the next day. So what you would do tomorrow is remove this needle and put a new one on. So to remove it, you just unscrew the protective cap and it just kind of, it just twists right off. And you're gonna take the new needle, you're gonna push it right on. And you can just change the needle fresh every time. When you're done, take these needles, you can either return them to us here for disposal at the practice. If you're gonna dispose of them from home, you should put them in some sort of a container, like a soda bottle that has a cap on it, and dispose of them that way. You shouldn't just throw these in your regular garbage can, but feel free to bring them back to us if you'd like them to be disposed of at no charge. Okay, good luck. Call us if you have any problems.